We're at the University of Illinois for this episode of the Paw Report. In fact, we are back at the Veterinary Teaching Hospital to check in on a new therapy offered by the Rehabilitation Services team. Coming up, we'll talk with veterinary technician Kim Knap on this shocking new treatment. Stay with us.
The Castle in Mattoon, Illinois, a gaming bar serving the Mattoon area since 1929. Full bar, draft beer, allocated bourbons, rotating daily specials, APA pool leagues, darts, and more. Monthly craft cocktail nights, open mic nights, and karaoke weekly. The Castle's lineup of concerts and events are on their Facebook.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Welcome back to the program. We are on the road again at the University of Illinois at the Veterinary Teaching Hospital with a familiar guest to the Paw Report. We welcome back to the show Kim Knap with Rehabilitation Services at the University of Illinois. It's been a few years, but welcome back to the program. Lots of new things happening in your area of the teaching hospital, Rehabilitation Services.
That's right.
So why don't we start there? Introduce us to your department again.
So I work in the rehabilitation facility at the teaching hospital, and in general what that means is we do physical therapy on animals, and that can be dogs, cats, horses, anything in the hospital that needs therapy. I am the go-to person. My typical caseload is a decent amount of patients after they've had some type of an orthopedic procedure or surgery, so they'll come to me for therapy just like a person would. We also work closely with the neurology service, so when they have patients that come see them, then that's installed with my service to get the therapy plan going as part of their adjunct treatment for their condition. But I also have a large number of patients that come to me from the community, people as far away as an hour, hour and a half that'll come for outpatient therapy sessions on a fairly regular basis. That can be once or twice a week for literally the longest standing one I have right now has been coming to me once or twice a week for 11 years.
Oh my.
So we develop very close relationships. Yes. And those patients are any combination of weight loss patients is actually a really big one, dogs that have chronic arthritis, dogs that have chronic neurologic conditions, hip dysplasia, elbow dysplasia. A lot of people have heard about those kinds of conditions. This is something that we can do to keep the structures around those abnormal joints as healthy and as strong as possible. So we have lots of different tools that we can use, but it's basically working with their veterinarian and their other plan as far as pain medications and rest and those sorts of things. But then we add in the rehab to sort of take that quality of life to the next level.
You know, I'm rude. I forgot to also introduce somebody else that's in the room with us today. You want to tell us about Dixie? And then Dixie's going to help us with some of the techniques today.
So this is Dixie. She's a 2-year-old English Mastiff acquired from a rescue. My son grew up with an English Mastiff, and we went about 4 years without one. And when he asked me if we should get another one, he didn't really have to twist my arm very hard. She's incredibly sweet and incredibly smart. She's a little bit needy, as you can see.
Yes.
But she's also nice and calm and a good dog to show some of the demonstrations and stuff on. So she came along with me to work today. She was very excited to jump in the car
to be
this
on
morning.
TV, Dixie.
Yeah, she doesn't know she's on TV because the 2 brain cells haven't registered that, but that's okay. Can you sit, please?
Can you sit?
Can you sit?
Well, you talked about the different reasons why somebody would come and seek your help. In your department, you have a lot of therapy options in the toolbox.
Yes.
Can you talk about some of those? And we're going to launch into the newest one,
Yeah.
but without revealing that one, some of the other techniques that you use.
So there are a number of things that can be used, and it's really patient dependent, condition dependent. One of the biggest things that the outpatients come in for, so the chronic arthritic patients come in for, is like the water treadmill. We do a decent amount of therapeutic laser with them. We also, any patient that comes to see me for a consultation gets a complete home exercise plan. So even if they have things that they're going to be doing at home, like you would get a workout plan, to strengthen the muscles that are involved in their condition. So the owners will actually have things that they can do at home, and some people will just come for that and then take it from there. So that's actually a really good tool because that's something they don't have to drive here for. We really are a full service rehab facility. The only thing we don't have is a swimming pool. We have a land treadmill. We have therapeutic laser, therapeutic ultrasound, electrical stimulation, land treadmill. I don't know if I said that already. Pulse signal therapy is kind of an elite treatment that uses a really strong magnetic therapy to heal cells. That's sort of an exclusive type of equipment that a lot of facilities don't have. We also have high technology equipment for our evaluations. So we have different machinery that the dogs, it can measure. So when you look at a dog and you're evaluating them, you're looking for lameness or discomfort, or are they having a hard time walking, what leg seems to be bothered, etc. And so you can always document that somewhat subjectively and give them a score of their lameness. But we also have an piece of equipment that the dog just walks across the mat, and it tells us exactly how much weight they're putting on each leg, exactly how long that leg is on the ground, what the difference is in the stride length. So it gives us more objective measurements to the lameness, and typically it's a great way to monitor progress and improvement. So we have a lot of cool things that we get to play with on a regular basis. So,
and you have a lot of cool patients. I mean, you see, patients like Dixie here, big dogs, but it's not just dogs.
No, it is not just dogs. I often have students and clients ask, do cats do rehab? It depends on the cat.
I can't imagine cats.
It depends on the cat, but we have absolutely had cats in the water treadmill. We've had cats in the land treadmill. We've had cats that swim. Truly, honestly, I wouldn't lie to you. But I've seen everything. Horses, absolutely. Llamas, alpacas. We had a potbelly pig that was obese that we were working with, and that's actually a funny story because the only way we could get the potbelly pig to do anything was to give it food, and it was coming to us because it was
overweight.
Obese. So that didn't work very well. I've had a toucan. We used to work with the wildlife clinic a lot. We used to do a lot of therapeutic laser and stuff on some of the wildlife stuff that was injured. They have over the years been able to fundraise and get their own laser, so they don't need me for that anymore. But I've worked with snowy owls and bald eagles, and we had an opossum one time that we worked with in conjunction with their plan over there. So
you name it,
you name it, I've seen it. Yeah, I've never done anything with a snake or a lizard, but we've done it. Guinea pigs, literally anything. Bunnies.
Wow. Well, today, I was really intrigued after kind of following up with your area, the rehabilitation services, and I learned about shockwave therapy. Relatively new to the department. So how and when was that introduced?
So the shockwave therapy has been a technology that has been around for years and years, okay? Very popular in horses because it's really effective against soft tissue and ligament injuries, which is a common injury in a lot of performance horses, okay? So the ligaments and tendons in the body, it takes a very long time for those things to heal. They don't often heal appropriately because the blood supply to those areas is not great. It's not like a muscle or something like that. So it has been available for a long, long time and has been used in horses. The problem with the old technology or the old units is that they're very loud, they're noxious. It's a very loud, like popping noise, and actually quite painful. So in order to use the older technology, the older units and do shockwave, the patient would have to be heavily sedated. And so it was never something that I felt like I needed to get. Just because I have a lot of other tools in my toolbox that can cause similar improvements that I don't have to sedate the patient for, because truthfully, it's not something clients like to do unless it's absolutely necessary a lot of times, which is completely reasonable. However, there's been a lot of advances in technology, like there is everything science. And the new technology has come out where it's very easily tolerated, even in cats wide awake. They've been able to decrease the noxious nature of the treatment itself. It's still a little bit loud, but not bad at all. We have these little headbands and things that we can have the dogs wear if they're sensitive, but most don't care at all. And so we can do this on a completely awake patient now. And it's probably, as far as the tools in the toolbox, ligament and tendon injuries and soft tissue injuries are it's my go-to for that. The equipment was very expensive, so we kind of petitioned for 2 or 3 years to get the unit, and obviously, you know, in the state of Illinois, times are hard.
Yes.
So we were really lucky at one point to, I just got a phone call from a long-standing client and donor one day, and it was the end of the year, and they were looking to make some donations, and I said, you know, I've really been trying to get this Shockwave unit. It's X number of dollars. It's, you know, in the excess of $30,000.
Wow.
And we had some money that we've put aside and we'd saved up, and they were able to jump in and pay for the balance of that.
Wow.
Just because.
Yeah.
So that was
Of the
really
great work you
incredible.
do.
Yeah, I still get chills when I talk about it, because it's really cool that someone's able to do that for
Yeah.
us, and believes in what we do so much that they'll hand over their own money for us to be able to provide treatment to other pets.
Yeah.
Yeah.
So what's the difference between shockwave therapy and laser therapy, if there is a difference?
Most of our modalities, the biggest difference is the type of energy used to produce a change in the cell. Okay, so that's what are we using to make the cell change in the way that we want it to. So laser uses light, and it's a very specific frequency of light that goes into the cell, the energy portion of the cell, and stimulates reproduction. So it's sort of it makes the cell hyper and makes them reproduce more quickly. So it accelerates healing, it helps with pain, helps with inflammation, etc. The sound wave, the shock wave therapy is actually a very intense sound wave. And what that does is it actually, if you've heard of anyone that has kidney stones, there's a treatment option called lithotripsy, where they'll take a sound, like a really, really high-powered ultrasound, and they'll aim it right at that kidney stone, and the sound vibrations will explode the kidney stone in the body. So it's something that they're going to send all this energy to this little rock, and it explodes. Mm-hmm. But they're not touching the rock. It's just the energy of the sound waves that come at it. It's the same technology, but it's targeted a little bit differently, but it's a sound wave that goes in and basically squeezes the cell to start inflammation, to accelerate the healing process. So a lot of times what will happen in these chronic pain cases, you're going to have cells that are abnormal, but they've kind of given up. They've said, okay, I'm not going to heal anymore. I'm hurting, I'm sore, whatever. And so what the shockwave does is it wakes them back up and makes them start going back through that healing process. So it'll take kind of a chronic pain case and increase it to an acute pain phase where you can hopefully get to another level of comfort, another level of healing. So it's really crazy cool technology.
So this is whether it's surgery, arthritis, it could be hip dysplasia. So
Yes.
the trauma can be any of those things.
It can be a chronic thing, or it can be a new thing, like after surgery, or bad hips, bad knees, lower back issues. I love it for that. Mm-hmm. So we can use it for a lot of different things.
And this is it?
This is it. This is
see what
that
it looks
very
like.
fancy, expensive piece of equipment. It has a big wand that we plug in when we turn it on.
Okay.
Oh, Ditsy wants to see it. So what this does is we hook it up to the machine and we set it appropriate to whatever the situation may be. And there's gel in here, so it helps transduce the sound waves. It's not a treat, but you can think it is. So before we use it, we have to actually shake up that gel in there. And then all we do when we're treating a certain area, let's say we're gonna treat Dixie's lower back, if she'll bring it around to me. Come here, Mama. Yeah, you don't have to lay down. That's your default. Good girl. So we'll put ultrasound gel on the skin, so it's a little bit messy, but that helps the sound waves go through to the tissues of interest. And you literally will just you'll just continue to move the head over the treatment area for the set period of time and the set
You don't have to
period of
shave
shocks.
them. I think a lot of pet owners might worry about that.
Yes, a lot of pet owners, if you have a really heavily coated dog, truly it's probably best, like a big thick coated Australian Shepherd or a Bernese Mountain Dog, it is usually best and most appropriate to shave them. However, there are a lot of techniques that have been developed where you can part the hair and put the ultrasound. It's very labor intensive to do it without shaving, but it can be done.
So Dixie comes in for this type of treatment. How long does the treatment session last, and how long does she have to come in before you start seeing some results?
Okay. Typically, the treatment itself literally is usually less than 5 minutes. It's usually 2 to 3 minutes, depending on the treatment area. We will see them once, and then again in 2 weeks, and then again in 2 weeks. So it's usually 3 treatments for 2 weeks apart. But the cool thing about the Shockwave is that most of the science is showing that it's effective. So it's 3 treatments, and it's effective for up to 12 to 18 months.
Oh.
So that's the benefit of
Yeah.
it. Nothing else that I do lasts more than a few days. But it is costly. It's an expensive treatment. So we kind of try some of the other things first, but when those aren't working, then we'll often pull this out.
Does it hurt? So you have the
It
device,
doesn't.
and obviously it wasn't on for Dixie, but
Right.
if it's on, does she feel it? I mean, or-
Really, it's not, it's just like a light tap.
Oh,
So it's just a light tap to the tissue. The old machines, they used to describe it as taking a rubber band and like slapping it against your skin repeatedly. This is just a light tap.
What is? Oh, I'm sorry. Go
No,
ahead.
you're okay. And some patients may be a little bit worse immediately after the treatment, just for 5, 8, 12 hours, but are fine after. And some patients show no effect at all, no change at all. So they can have a visible reaction or not. But the improvement is what we're watching for. But the treatment itself doesn't seem to be causing any serious issues with the patients that I've worked with.
Earlier in our discussion, you had mentioned pulse signal therapy.
Yes.
Another therapy that's
Another
in your
tool.
toolbox.
Yep.
Can you go over that? And I'm going to mention to our viewers, if they hear a little barking, we are in the veterinary teaching hospital, so we may hear some dogs, that are just getting some treatment. So
Yes.
they're a little vocal.
Typically maybe even upset that they're by themselves and not with their owner or with the
Yes.
student right now. So the pulse signal therapy is a really interesting treatment technology that we've used for several years, and actually many, many years ago, Dr. Diane Dunning and I did a fair amount of research on it, looking at the efficacy of treatment of arthritis and some neurologic conditions in dogs. What I love about the pulse signal therapy, number one, the energy is just magnetic therapy, which seems so silly, right? But it's a very, very strong, very targeted magnetic therapy that again is stimulating those cells to come out of that hibernation mode and wake up and heal and help those tissues feel better. The thing that's the best about the pulse signal therapy, in my opinion, is that you can treat multiple joints at a time. I potentially can send you a couple of pictures, but they literally just lay in this chamber for 30 minutes. It's 9 treatments in a row. So each day they come for a 30-minute treatment, but most of them just fall asleep. They don't feel a single thing. But if I was doing Shockwave, a lot of orthopedic diseases are on both sides. So if they have one bad hip, they most likely have 2 bad hips. If they have one bad elbow, and I would have to individually treat each of those areas with the laser or with the Shockwave. With the Shockwave, each treatment area is between $400 and $500. So it's very expensive. And a lot of pet insurances are covering it, but it's costly. So the pulse signal therapy is significantly less expensive, and I'm treating a lot of areas at once. So if they have arthritis, the last dog I did had arthritis in her elbows and her paws and her shoulders, and she just laid in there and everything was getting treated all in one 30-minute treatment time. Super easy, super non-invasive, and they don't feel a thing. They just relax and go to sleep in there. So it's really cool that I can do that with some of these. And the pulse signal therapy, there's some science that proves that it can help dogs that have kind of chronic or kind of long-standing mild neurologic dysfunction, that it might actually be helpful for them. And a lot of our other tools have not been proven to do that. So it's, everything you sort of pick what's wrong, what your problems are, and what you think would be the best thing to help them. And there's not a right or wrong way. I may do something completely different than another clinician.
Right.
But we all just pick the tools that we like, that are comfortable with. Good sit.
Any side effects to any of the
No.
treatments?
So truly, I think the biggest one is any of these things are going to stimulate cells. So it's often contraindicated in animals that you feel may have neoplasia or cancer in that area. Obviously, you don't want to stimulate cancer cells to reproduce. It is not going to cause cancer, but it does make those cells happier and busier. So that's the biggest one. We don't usually use some of these in reproductive animals just because, again, you could be causing some mutation of cells and things like that. But most of the time when we're just treating joints and specific areas of interest, it's very, very safe.
Can the shockwave therapy, which is this, be used on all breeds?
Yes.
Is there a weight limit or?
No, it's something that was developed originally in horses, so it can be used in a lot of big things. And actually, one of the things I'm kind of excited about is we do some consultation with some of the small local zoos, and those big camels and giraffes over the years have had arthritis and different issues like that, but treatment of them is difficult. So maybe the shockwave is something we can use for those guys at some point in the future and see if we can give them some relief. I know at one point one of our doctors that does acupuncture was going over to the zoos and doing acupuncture on the camel that was really arthritic and having a hard time to try to make them feel a little bit better. And I feel like this could potentially be one of those things too that we could do.
You mentioned, I'm going to pedal backwards here for a moment, the expense of doing shockwave therapy. It's expensive. Hi, babe. Can you go over that again, and how does that compare to like the pulse therapy?
Yeah, so the pulse signal therapy usually ends up being just under $1,000 for the entire 9 sessions. Okay, the shockwave therapy runs $400 to $500 per treatment area, and you're looking at about 3 of those, so that's about $1,500. Both of those things are shown to be longer lasting, but if you're treating several elbows, for example, you have both elbows and both hips, that's $1,000. Actually $2,000 per session. So then you're looking at $2,000, $4,000, $6,000.
But insurance may cover some of that.
Insurance does, depending on the plan. There are some insurance companies that are covering it, and that's been pretty impressive. Yeah.
I know that viewers may, sticker shock, but you have probably a novel of success stories that you could talk about how this therapy works, and it's shown strides in the medical field in rehabilitation services.
Yeah.
Can you tell us a little bit about some of the stories that jump out at you?
So, in the beginning, it was a lot of working with animals after they've had surgery, and it's sort of I'm not going to say without promoting, but it's been a very natural transgression of pretty much everything can benefit from rehab. Just like in people, if you're in the hospital and you have an abdominal surgery, they want you to get up and walk around the hallway before you leave. So we're finding benefits in all different types of patients for all different types of reasons. And we're making good improvements. And one of the things I often say to the clients is that sometimes what I'm doing doesn't provide what we would call academically stimulating results, meaning it may not be scientifically thrilling, but they're huge quality of life improvements. So things like my dog hasn't been able to jump into the car for years, and all of a sudden she jumped in the car and she's happy to do it. My dog can't climb on the bed anymore. My dog's laying around the house more, not wanting to do things. So it really revitalizes these dogs that have chronic conditions, especially in their last years. You want to make sure that those quality of life is very good. And rehab itself is extremely affordable. To just come for a session of therapy is the highest is $58 or $50. And then we have kind of a package that you can discount down from there. And that would include most of our modalities. The only things we have to charge extra for are these really, the ones that are costly to us. When that wand runs out of treatments, I have to buy a new wand.
Right.
So we have to document how we're using those treatments so that when it's time to buy a new wand, I can justify it, if that
And you
makes
probably
sense.
share with people things they can do at home too.
Yeah, absolutely,
You
yeah.
know,
The home
to
exercise
continue
plans,
the rehab.
even if it's just some stretching and some core exercises or sit to stand exercises, it doesn't have to be, crazy stuff. It can all be beneficial because we've learned that movement is best, even if it hurts sometimes. But with dogs, we just go a little bit slower, a little more conservative.
So if anybody out there has any questions or maybe is thinking about needing some rehabilitation services, they can contact you here at the Veterinary Teaching Hospital.
That's right. I'm it for now.
You're it for now. She's a one-woman show, but she has a lot of volunteers and a lot
I
of
have
assistants.
an amazing number of staff and helpers that keep me afloat. But Yep, I'm the face and the one that will answer
Big-
the phone.
big
if you
cheese,
call.
as we
Yeah.
say.
Oh, the big cheese. I wouldn't go that far.
Well, Kim Knap and her sweet buddy Daisy, thank you so much for once
Absolutely.
again joining us here on the Paw Report, sharing your knowledge about rehabilitation services and the new Shockwave therapy and all that good stuff.
Well, thanks for having me back. Hopefully it won't be this long again.
Can I take her home?
No. No.
Oh,
Owen
you're a
would be
sweetheart.
very disappointed if Dixie didn't come home with me today.
Well, thank you for joining us. And thank you, our viewers of the Paw Report, for joining us for this episode. Until next time, we'll see you then. If you're a veterinarian, trainer, groomer, specialist, rescue organization, or shelter that would like to partner with the Paw Report by providing expert guests for the show, please contact us by emailing weiu@weiu.net or call 217-581-5956. If you have a topic you'd like to see on the show or questions for our experts, contact us with those too.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
The Castle in Mattoon, Illinois, a gaming bar serving the Mattoon area since 1929. Full bar, draft beer, allocated bourbons, rotating daily specials, APA pool leagues, darts, and more. Monthly craft cocktail nights, open mic nights, and karaoke weekly. The Castle's lineup of concerts and events are on their Facebook.